Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, Michael Reynolds here with the Massage Therapy Foundation, and welcome to episode 1 of Research Perch. Again, I am Michael Reynolds, the chair of the marketing committee for the Massage Therapy Foundation, and I'm here with Niki Munk and Ruth Werner. Niki, how are you today?
Doing well, Michael, thanks.
And Ruth, you doing well?
Just great, thanks, Michael.
Awesome, we're so thrilled to have you. So for those who are just joining us here, Research Perch is a podcast designed to take research from the International Journal of Therapeutic Massage and Bodywork and really kind of unpack it and help bring it to massage therapists everywhere in a way that we can all kind of understand and relate to and figure out how it can help you in your practice. That's really our goal today. So since it's our first episode, I do want to start off with a short intro with our guests, our research experts. Niki, let's start with you. Niki, what's your background? Just a quick intro from you.
Well, my name is Niki Munk, and I am an assistant professor at Indiana University at the IUPUI campus. I'm with the Department of Health Sciences within the School of Health and Rehabilitation Sciences, and my research program is looking at massage therapy and functional decline, also pain and mental health components under the auspices of rehabilitation.
Fantastic. Thank you so much for joining us. And Ruth, how about you?
Well, my name is Ruth Werner, and I am the immediate past president of the Massage Therapy Foundation. I see myself not at all as a research expert, but as a really interested user, and with a special dedication to trying to sort of translate what's happening in the research world so that every massage therapist can use it.
Fantastic. Well, thank you so much. I'm thrilled to talk to you both. And again, our goal here is to take articles from IJTMB, which is at ijtmb.org, and that is the International Journal of Therapeutic Massage and Bodywork, and really, again, unpack some of the details here so we can really get a deep understanding of what that means. And again, Massage Therapy Foundation can be found online at massagetherapyfoundation.org as well, where you can see videos of these podcasts and, of course, subscribe via your mobile device. So let's get started. So today's article we're going to discuss for this episode is called The Effects of Self-Massage on Osteoarthritis of the Knee, a randomized controlled trial. So Niki, if we could start with you, could you give us a little bit of background on what this is?
Sure. This is a randomized controlled trial, which basically means that the participants in the study were randomized to either a treatment group or a no treatment control group for purposes of comparison. The folks who were in the treatment group were given instruction on how to do self-massage for their quadricep muscles, which has been shown to have an effect and need and correlation with osteoarthritis of the knee and the pain in those pieces. So their measures and interests of outcome were pain, which were measured by the WOMAC scale, which is a really reliable and often used measurement tool in this population, and then also on range of motion. So what's really great about this is there's a lot of work being done with osteoarthritis and massage with the folks at Duke, with the Perlman group, and they're using massage therapists practicing in the real world and in their integrative medicine clinic. And this particular study is really unique in that it's allowing the participants to do their own massage and seeing what the effects of that were. And this is really great because it speaks to one of the biggest troubles with massage, in my opinion, which is accessibility for folks. And the reality is that so a lot of people aren't able to afford it, and to be able to provide and have options that get the good effects of massage, to be able to self-apply that is really great.
Okay, great. So what I'm seeing from this is that self-massage did have a positive impact on stiffness and general pain of the knee, but it didn't as much or didn't affect range of motion. Am I reading that correctly?
Correct.
Okay, so Ruth, in your opinion, how would this affect the practicing massage therapist who is treating clients? How would we use this to help our clients?
Well, there's all kinds of ways that we can use information like this. As Niki brought up, for a lot of people, accessibility of massage, especially since in most places it's an out-of-pocket expense, becomes an issue. And if we have clients who are really struggling with osteoarthritis at the knee, this is a thing that they can do in their own self-care that can augment what happens with their regular massage. You know, it may replace it, but I think most findings would be that it's useful, but maybe not as useful as a professionally delivered massage. But certainly, here's a place where massage therapists can really be good health advocates for their clients. I want to link this again to something Niki said about what's happening at Duke and Dr. Perlman. So some of our listeners might be familiar with Adam Perlman and his work. He's currently working on the largest NIH grant, National Institutes of Health grant, in history for massage therapy, investigating the use of full-body relaxation massage specifically for people who have osteoarthritis at the knee, and he's getting tremendous results. And what, as someone with a background in pathology, what really speaks to me here is if we can take someone, and most of these study participants have been elders, at least in the self-massage one that we've looked at today. If you take someone in their 60s, say, who has really troublesome knees and might be a candidate for a knee replacement, if we can delay that need for, say, 5 years, the life expectancy of that replacement is much better. I mean, every joint replacement has a sort of a lifespan, and every subsequent surgery after that to fix it has a higher risk of failure. So we would like for people to hold on to their original knees as long as possible, and to minimize the number of repeat surgeries. And so a long-term application of a finding like this, where people can really substantially help with their pain and their stiffness by doing self-massage, can ultimately be demonstrated to be a huge cost savings when we think about all the risks and all the costs associated with joint replacement surgeries. And between this and Dr. Perlman's work, I think that massage is going to, this is a place where we can really talk about cost effectiveness for these kinds of interventions. I'd love to say one other thing about it that I remember from seeing the scientist present her findings at the International Massage Therapy Research Conference that was a year ago in Boston. She said that one of the real struggles with keeping this a randomized controlled trial and to a certain extent blinded is that the people who were doing the self-massage protocol were obviously moving much more freely in public settings, because some of this was done in a nursing home. Mm-hmm. And so people who had been using walkers were walking more easily. People who had been in wheelchairs were now using walkers. I mean, people were really having substantial differences in their function, and it made it very difficult to keep it quiet who was getting the intervention and who wasn't getting the intervention. And I love problems like that. Isn't that amazing?
Those are good problems to have. I'd also like to point out another thing that's really cool about this study is that these self-treatments were done in a group setting, and so you had the massage therapist essentially talking the older adults through the process and through the protocol, and then they had another therapist there demonstrating it while it was happening, and they did that for the initial, I think, the initial weeks. It was like about 8 weeks or so, and then they did the rest of the 3 weeks or something. They were doing that on their own time and in their homes or in their rooms. But this is a really great opportunity to apply it in settings like this, where a therapist may not be able to treat everybody individually, especially with the amount of treatments that might be the most effective. And I think in this case it was twice a week. And so if they were a therapist in a nursing home environment or an assisted living environment, were able to go and do a twice weekly class with folks and have 20, 30 folks there doing the treatments on themselves, and then were able to sort of augment that and pepper their own treatments throughout with the different patients, how effective that would be, and how this N of one therapist would really bring great impact to a larger community.
That's great. I can imagine a lot of massage therapists seeing that as a great opportunity to grow their practice as well, not just treating individual clients, but actually, like you said, going to facilities like that and doing group sessions and conducting classes, right, and then bringing that knowledge to other people to apply self-massage. That's fantastic from a a treatment standpoint and a business standpoint as well, I would think.
And a cost-effective standpoint too.
And a cost-effective standpoint, absolutely. It's a win-win, I would say. That's great. I love that perspective. Thank you. So tell me a little bit about, go ahead, Ruth.
Well, and think about what else people can reach to massage. What about hand massage? When people's hands get stiff and sore with arthritis, and what people could do for themselves or for each other. One of the things we see in our elder population is that it's a very, very low-touch time of life. And so to create some sense of community through a really appropriate, safe, and sort of purposeful kind of touch, to me just opens all kinds of beautiful possibilities.
Mm-hmm.
Yeah.
Yeah, and they were really particular in this protocol as well, to teach them how to do it without putting pressure or stress on other parts of their body. So they were using their forearms and leaning in with their forearms for the larger, broader, deeper strokes. So they weren't just pressing in with their thumbs and using their shoulders and harsh body mechanics for themselves.
Yeah, good ergonomics.
Yes.
Yeah. Well, help me just, I want to make sure I cover a couple of questions here. And this may be a dumb question, but I want to talk a little bit about scope of practice. And so as a massage therapist, obviously, massage therapists do not diagnose. How does a massage therapist know if it's osteoarthritis? What's the relationship with the client's physician? What are some issues to be aware of?
Niki, you want to take that, or shall I?
Oh, I was pointing to you.
Okay.
I have some thoughts on that, but mine's more in the realm of generalizing these sorts of findings to populations other than osteoarthritis folks, other just general knee pieces as well. So I'll let you talk about the osteoarthritis.
Let me talk more specifically about this one then. Mm-hmm. With any population, with any client, we are reliant on them to give us good information. If your client says, I have arthritis at my knee, it is always a good idea to ask what brings them to that conclusion. If it's because their knee gets sore when the weather's about to turn, that's a useful piece of information. But if they have also been through some testing, and specifically if they've ruled out some things that can look like osteoarthritis, and specifically I'm thinking about rheumatoid arthritis, this puts us on somewhat safer ground. As you say, Michael, we don't diagnose. We are allowed to have an opinion, but not to make a diagnosis. And particularly if we're dealing with elder clients who've had a lifetime to accumulate sort of overlapping disorders that can make things quite complicated, this is a population where it's really important to have good communication with some primary caregivers. Be aware also that in this population you'll have people taking all kinds of meds. And if those medications are changing the way the kidneys work, or if they're changing how we process fluids to manage high blood pressure, for instance, or they're anti-inflammatories, all of those things have some impact for the safety of massage. Doesn't mean we can't do it, but we may have to do it with some different kinds of cautions. So I appreciate you bringing up that question. Working with this population can be complicated. But for something, this protocol wasn't a lengthy one. If I remember correctly, Niki, it was maybe 20 minutes.
Right. It was a 20-minute session. Mm-hmm.
Right. And so
the self-massage session was about a 20-minute session?
Yeah.
Exactly.
The actual application? Okay, great.
Yeah, and that covered both legs.
Okay.
So, yeah, the overall systemic impact of this was probably fairly light, but what it really seemed to focus on here was creating some relaxation and sort of more liveliness in the muscles that cross the knee joint. So, in the world of things that could go wrong, there's probably pretty limited risk here. But always a great idea to check with someone's doctor. Again, think about osteoporosis, and if someone has a lot of bone loss in their forearms, which is not uncommon, then to ask them to bear down with a lot of weight on their forearm, on their leg, what might be something problematic. Does that make sense?
Mm-hmm. Yeah, great. Niki, anything you'd add to that?
But a rolling pin instead might be really helpful.
Okay.
There you go. Good point.
So bottom line here, just to kind of, like I said, bring it home with some very clear takeaways for massage therapists. With some confidence, massage therapists can say, if you have osteoarthritis, massage therapy can be effective in treating pain and stiffness. We obviously can't make the claim that range of motion will be affected, but based on the research, massage therapists can confidently say that this type of treatment can have a positive impact on pain and stiffness and alleviate some of that. Would that be correct?
That's correct.
The pain, I believe, is the key piece that we're getting from these findings. Is that correct?
I did note pain and stiffness were positively affected. I may have read that wrong. So how would I interpret that?
We're checking.
Yeah, we're checking, because my initial thoughts were that the WOMAC was primarily doing pain and in addition to pain, more the interruption and disruption to life that pain.
Bothersomeness is sometimes not.
Yeah, bothersomeness. Yeah. But stiffness sounds to me like range of motion type.
Well, in the abstract it does say stiffness, so that's good to clear.
Does it? Okay. Well, and I would just want to. I would need to actually go back into the article to see how they're measuring stiffness and how they're quantifying that.
Well, that actually makes a good argument for our listeners to go read the full article. So there's a hint. It might be a great idea.
And the article is open access, so anybody with a computer and internet accessibility can get the whole article.
Well, in that case, let's prompt our listeners. Everyone listening, be sure you go to ijtmb.org and look for this particular article. If you search osteoarthritis, I'm sure you'll find it. It's the one we're discussing now. So I think in any case, obviously it alleviates pain. It can alleviate pain with this type of self-massage treatment. So that's great. I think that's something that is really useful to massage therapists, because we want to be able to allow massage therapists to confidently back up their opinions and their treatment plan with research. And this is a very real-world, practical example. So I really love that.
Absolutely.
So, as we wrap up, is there anything that either of you would like to add to this that would help our listeners?
I'd love to suggest that listeners think about what might be the next question to ask. You hear a finding like this, or which is a nice fit with the findings that Dr. Perlman's group are coming up with. And to me, this inspires a whole list of next questions, like, can these people take fewer pain medications? Or can we see a delay in needing a knee replacement? Or, oh gosh, there was another one that I thought was really brilliant, and of course it's popped right out of my head.
Well, what are some of the other functional outcomes? If you go and look at the ICF model of health, which is used a lot in physical therapy and in other forms of rehabilitation, the ICF model, yes. So it's the International Classification of Function.
Thank you.
From the World Health Organization, the WHO's ICF model, and they look at function from 3 different primary frameworks. So you've got the body and structure, you've got the activities that folks will do, and then you have participation. So looking to see if these kinds of treatments will improve older adults' participation in life. These are activities with meaning. So are they able to engage in more of the community events? Are they able to not just walk, which is more of an activities measurement, but are they able to go to the grocery store on their own? Are they able to get in and out of their vehicles on their own? Those are participation type measures, and those are the things that clients and patients are really, really interested in. While knowing that their range of motion has improved by 10 degrees is great, they're more interested in whether or not they're going to be able to get out of bed easily and play with their grandchildren and go to the grocery stores for themselves. Those are the things that are important to them.
Okay. Well, luckily we have more episodes to go. This is only our first, so we will definitely address many more of these topics later. And if any of our listeners do have questions you'd like to ask us or things you'd like us to discuss on the show in future episodes, email us at perch@massagetherapyfoundation.org or tweet us on Twitter, use Facebook, contact us through our website, massagetherapyfoundation.org, and we will do our best to address those. So anything else you'd like to wrap up with, Ruth and Niki, as we sign off here?
Please use the International Journal of Therapeutic Massage and Bodywork. It is our profession's only open-sourced academically peer-reviewed journal specifically for massage therapists. And how much does a subscription to the IJTMB cost, Niki?
As a matter of fact, a subscription is free.
What a price.
Free.
All right.
Yes, and it also doesn't cost to submit articles. So a lot of open access journals require the authors to pay to have it published, and ours has no fee.
Great. All right, that's ijtmb.org. All right, well, thank you both. Niki, thank you so much. Ruth, real pleasure. Thank you so much for your input. We will definitely dig into some more topics here on a future episode. So if you're watching, please click below to subscribe via your mobile device. You can take it with you. If you're listening, keep on listening, and also visit us at massagetherapyfoundation.org where you can watch the video and or post comments. So again, thank you both. Thanks everyone for listening. We'll see you next time.
See you next time.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.